Unmute the mic, speak up. The male perspective. Caregiving knows no boundaries. It's time to hear from the voices that often go unheard. Meet our global male caregiver speakers, sharing their powerful stories, experiences, and insights. Introducing our esteemed presenters, Dr. Wayne Freeman, Kevin Jordan, Dr. George M. Ackerman, Trevor Jeremiah Carter, Keith Demps, Basiliso, Bas Moreno, Lance Aslatin, Mark Varkavisser, Michael Waters, Scott Wells. Connect, learn, be inspired. Together, we are stronger. Together, we make a difference. And now, meet our beautiful summit hosts, Cheryl D. Mims and Christina Keys. Reserve your ticket now and be part of this impactful event.
To everyone in the audience, good morning, good afternoon, and good evening. Good evening from Singapore. Now, first question. How many of us here would like to live beyond the age of 80? Could you just type in the chat, yes? If you'd like to live beyond the age of 80, type yes in the chat. Whether you're on LinkedIn or Facebook or YouTube, just type yes if you like to live beyond the age of 80. Give us a few seconds to do that. Christina says yes, please. Thank you. Marriage and health, yes, thank you. Right. Thank you. Trevor says yes. And I think the yeses will come in. In the speeches that I have given, almost the whole room would say yes. Now, I'd like us to imagine right now you are 85. Just put yourself in the state of mind when you're 85. Okay? That you're 85 right now. Okay. Now, I'd like you to look just into the screen, whichever screen you're looking at, whether you're on LinkedIn or your Facebook or YouTube, or if you have somebody around you in the house or in the room or wherever you are, look at two other people. Okay, just now you're 85 and look at two other people. Right. Thank you, Suzanne, for saying yes. Thank you, Joe, for saying yes. Thank you, Jasmine, for saying yes. Thank you, Laura, for saying yes. Now, look at two people. Now, one of you is going to have Alzheimer's disease at 85. And if you think, okay, no, that cannot be me because I'm not so unlucky to live so old and still be stricken, then, well, the statistic is you're a caregiver. That's how scary this disease is, this Alzheimer's disease, this dementia that come with it. For decades, despite decades of research, neuroscience research, we are not close to a cure, a treatment. So it seems like if we are lucky enough, we're fortunate enough, blessed enough to live long enough, Alzheimer's and dementia appears to be our destiny. What if today I tell you this, that today, you could do something to reduce the odds, reduce the likelihood of getting Alzheimer's disease or becoming a caregiver for someone who does. Would that be of value to you? I'd like to bring us to a time when I was 21. I found myself kneeling on the cold tiles of my grandma's bathroom, my grandmother, my mom's mom, struggling to change her adult diaper. It was really an embarrassing moment for me. It was the first time I did this, and I remember my hands were shaking. She looked at me like, not out of frustration or anger, but perhaps wondering if I would get it over, and perhaps she was wondering why the pause. And I just wondered if she realized I was so embarrassed. You see, I wasn't a nurse, a doctor. That was my first time doing any caregiving. I wasn't trained to do this. In fact, I didn't want to do this, but I did this because my mom, who was depressed at that time, was caring for her mom. And I thought my contribution could reduce her feelings of sadness. So I was just a grandson trying to make life easier for my mom and my grandmother who took care of me when I grew up. And that was how I was thrown into this world of caregiving. There was this incident with my grandmother I will never forget. I came home late one night, about 8 o'clock, and she was in the kitchen, and we had this talk. this conversation. And somehow I didn't agree with how I should care for her, and she wanted me to do something. I can't really recall the content of that conversation, but she was like saying, Wayne, could you just get this done like tomorrow? And I was saying, no, Grandma, how about during the weekend? I can help you during the weekend. And I just blew my top. And in my frustration, guess what I did? In my frustration, I actually pushed her. And I regretted my decision straight away. You see, she was frail, 86 years old at that time. She had rheumatoid arthritis, diabetes, heart problems, and my push just landed her on her elbow on the floor in the kitchen. Thankfully, she wasn't seriously hurt, but what broke my heart. Her very precious jade bracelet on her right wrist, if I could recall correctly. That jade bracelet. Now, I don't know if you understand this. A jade bracelet is a family heirloom of ours, and to the Chinese in Singapore and many other places, to Chinese people, and certainly to that generation who were born in the beginning of the 20th century, like my grandmother, is something very, very precious. That precious heirloom was broken into 3 distinct pieces. If I was allowed, I would have shown you a picture of that. 1 jade piece to 3 pieces. I regretted my decision. I apologized and I just broke down. I didn't realize caregiving could be this bad, this stressful. When I came to my senses, I had some reflection and I realized Mom probably would have gone through worse. And that was just my grandmother. So, long story short, my grandmother became even more frail and she was admitted into a residential facility. Eventually, she passed on in that facility from sepsis, basically a shock to the body. And that was my first caregiving journey at the age of 21. Years later, my mother, she was diagnosed with ovarian cancer of the ovaries. Right. By then, I had some caregiving experience caring for my grandmother. I know how to change an adult diaper. I knew how to manipulate the wheelchair. I was able to control or at least manage some of my emotions. But what I couldn't control was this. Being a sandwich caregiver, being torn apart by the needs of my wife, who was expecting our first child then, our son, and my mother. You see, at this time, on a fateful day, both of them had a medical appointment, same city, same hospital, just different department, 2 different buildings. My wife had a prenatal check, that kind of check that would determine the sex of our child, and that kind of checkup that any first-time parent, father or mother, would look forward to, because that gives me and my wife then some inspiration, some imagination about what life would be then. I was really looking forward to that, and my wife needed me to be there. But at the same time, on the same day, at around the same hour, my mom, who did not respond to the cancer treatment by the oncologist, had to see the oncologist and other members of her treatment team to discuss changes to her treatment. And wow, I mean, I think earlier Dr. George talked about being a sandwich caregiver, and Bess talked about being a caregiver, a male caregiver, and I definitely raised my hand as a sandwich caregiver, at least during those days. And that was even before COVID. I was torn. What could I do? Should I be with my mom or with my wife? Yeah. And that was before COVID. That was before the days in Singapore where we had electronic digital devices that could help us, manipulate, get a quick glimpse of medical appointments of loved ones and stay connected. And before all those integration of care and appointments was done. So I was just kind of holding two slips of paper, just waiting for the fateful day. Thankfully, my wife was understanding, but my brother also stepped up. So my younger brother, was able to accompany my wife, my mom to the appointment with the oncologist and the team, so I could be with my wife. But you can imagine that kind of being torn apart, just having to make a decision. Eventually, after a year and a half of struggling, my mother passed on from cancer. And just within the same month, guess what? Well, I thought caregiving was going to be over and I could now focus on being a parent caregiver to my son, right, who was then 6 months old. My dad fell because of a series of strokes called transient ischemic attacks, or TIAs, mini strokes. Turns out that his cervical spinal cord, was it the C3, if I recall, or C2, the part that was responsible or that was implicated in breathing, right, was affected. And so for a good 2 weeks, he was in the hospital and the doctors were trying to see what help he could do. But eventually, when he was discharged, he was really frail and he had breathing difficulties. He couldn't walk few steps without becoming breathless. So I stepped into the caregiving role again. This time, although with a helper, a domestic helper, we had to make difficult decisions on his care. Wow, I could just remember so many stories. But eventually, that was the time I recall. I think I was drowning, because at that time, while my son was already born, right, and I was I was already, in fact, in the second time as a sandwich caregiver, but at that time I was juggling full-time work. I was doing part-time PhD studies, and I was caregiving. So every day felt like a cycle of exhaustion. Work, caregiving, studies, repeat. Work, caregiving, studies, repeat. I had to adapt, setting routines, scheduling meals so I won't forget to eat, keeping my dad engaged on days that he felt a bit more energetic, so his muscles do not waste away. One thing I learned to focus on small wins, small victories. Some days, small wins wasn't about curing, wasn't about getting a cure for my dad and restoring his breathing ability. Some days it was just making him smile, getting him to helping him to eat what he likes to eat, bringing him to a place where he likes to be, just to enjoy, say, a movie or a musical performance, a concert. And that, to me, wow, was a small victory. To him, that's huge. But to me, that's something. And I didn't know how much impact I made until later, much later. And of course, I asked for help, my brother, my friends, hospital staff, many professionals, and it wasn't easy. Caregivers like us often feel like we have to do it alone. So one thing I learned was to ask for help. Yet no matter what I did, one painful truth remained. In each of these instances, when I became a caregiver, for first my grandmother, then my mother, and then my father, actually, I was never really prepared. There wasn't a playbook to tell me, look, here's what you can do and what you should do for your grandmother at that point, and then for your mother, and then for your father. Much as I gained experience caregiving generally, but when it came down to the actual decisions to be made, the care decisions, when it came down to the care tasks, I can share with you, I never really felt ready. So I walked through this, if you would like, fire, this kind of crisis, one after another. And I don't know how, but something in me kind of just refused to give up. Well, I knew I had several roles to play. Somehow, by the grace of God, I survived. I survived mentally, I survived emotionally. I thought at one point I was going to get depressed, really, myself, just caring for my dad. Eventually, my dad passed on, not due to breathing difficulties, but he had a heart attack, and We were sad that he was gone just like that suddenly, but we are glad that his suffering wasn't prolonged beyond the minimal. Right. What I learned out of this transitions, I could move from just being a caregiver to becoming a change maker. I could move from care to change. When I was in the pits, when I started to question life's purposes, I stumbled upon this movie. Many of you probably have watched this. It's called Still Alice, right? If you have watched this movie, type in the chat, yes. Still Alice, right? It's a movie that describes the heartbreaking journey of a linguistic professor diagnosed with early onset dementia, Alzheimer's disease, related dementia. And what struck me the most wasn't just Alice's suffering, this professor, but her families, those caregivers, her husband, her children, watching helplessly as she forgot words, routines, and eventually the people she loved. She'd forgotten them. They struggled with denial, frustration, so many things. The impossible choice of how to care for her while holding on to their lives. These are caregivers. And that movie hit me hard. If caregiving was hard for me, and none of my 3 care recipients, my grandmother, my mom, and my dad, were dementia sufferers, had dementia, had Alzheimer's, had vascular dementia. How about those who care for somebody who no longer recognize them? How about caregivers of dementia patients? I started reading more and started doing research, and guess what? My PhD research topic eventually became, you guessed it, caregiving. I eventually published my thesis on this topic, the association between caregiving burden, caregiving depression, and caregivers' health status with use or non-use of long-term care services. You could easily Google that, find that in Google Scholar. As I did this, I realized that families were being thrown into caregiving roles, unprepared, just like me or worse than me. If I felt the strain, people out there are getting it worse. Some of them watch loved ones fade away without hope, right? And yet we're not talking about it. Not in Singapore, not in so many places. And as male caregivers, as men, as young men and middle-aged men, we don't talk about it. We sit in the coffee shop or at a cafe and drink our coffee alone and feel cool about it. And people look at us cool about it. We don't talk about it. Yet at the same time, we had this lack of knowledge, as if dementia is inevitable. That once you are diagnosed, that's it. And if you're not diagnosed, there's nothing you could do about it. That's in fact not true today. Families were burning in silence. And that is what motivated me to go into dementia research, so that I could move from care to change, from caregiver to a change maker. And so when I dug deeper, I realized this. 45% of dementia risk factors are actually amenable to change by the self. Risk factors like poor sleep hygiene, like poor nutrition, like poor mental stimulation, social isolation, early undetected hearing loss and visual loss. All these could be amenable to change if we knew about it and if we knew how. That particular statistic changed everything for me. It really did. If dementia wasn't inevitable, why are we waiting until people got sick in order to act? And then we call it dementia care. Why don't we do prevention efforts? One of the most famous studies on aging, if you have heard of this, is called the Nun study. Right? In this Nun study, right, something amazing, something extraordinary was found. You see, when researchers examined the brains of these elderly nuns upon autopsy after they have passed on, they found brains that were full-blown with plaques and tangles. Unquestionable Alzheimer's disease. Unquestionable. Biological. But when they correlated this finding with the interactions and the lifestyle of these nurses while they were still alive in the last years prior to passing on, they found seemingly no memory loss, no complaints by people around them, no nothing. It's as if these nuns went through all of these life as any other nun, as any other person would, while these plaques and tangles were in the brain. Why is this? That's because these nuns have trained their brains for resilience. Today we call this cognitive or mental resilience. Right? They stay active, they were socially engaged, and they were living with a purpose. So, if you're interested, Google the Lancet Commission. That's the report that was published last year, 2024, that says 45% of dementia risks are modifiable. Right? And these 45% are within our control. That's when I shifted from just supporting caregivers to also supporting caregivers by helping them prevent dementia for themselves. I'd like to share with you 3 things in the program that I do today. Number 1, train your brain. A strong brain isn't a gift, it's a habit. We could learn something new, like a language, like skills, and solve puzzles. Not doing the same old thing over and over again, not sitting behind in front of the television and watching Netflix, but you could learn something new. We could train our brains by social engagement that reduces cognitive decline. We can reach out to new people, we can reach out to other caregivers and share our stories. Right. One takeaway I could leave you with is we could challenge ourselves, you could challenge yourself to learn something new every 6 months. Train our brain. The second thing we could do is to vitalize our veins. That is, improve blood circulation by exercising 150 minutes a week. That in itself cuts dementia risk by about 10%, 7 to 10%. Having Mediterranean diet, keto diet that is nutritious, sleeping 7 to 9 hours a day. And if you don't get that amount of sleep, learn how to improve your sleep hygiene. These would help us vitalize our veins. And the third method that I do in our program today, just to help caregivers in general and specifically those who have family members with dementia, is to help them share their stories. And that is what this particular platform is about. We share our stories. Stories that shape our identities as caregivers, as a member of the sandwich generation, as a person who have anxieties, as a person who may require at some point therapy, and it's perfectly fine to get into therapy, even for a psychologist, even for a scientist, right? Sharing our stories not only shape our future, but if dementia is something that we can control, up to 45% of it, sharing our stories actually allow us to take concrete steps to reduce the likelihood of dementia. So 3 things I leave you with. Train your brain, vitalize your veins, share your story. I'd like to end by sharing a powerful story of one of my clients. She's a retired teacher, K1 to K12. In Singapore, we call that the primary school and the secondary school, the first 10 years of life. She's a teacher of adolescents and children. She was terrified of memory loss. She's retired now. She watched loved ones fade away. She had a father and a mother-in-law who had dementia. And when she came to me, she was convinced she's going to be next. Right? I remember she telling me, look, Wayne, is there a way I could test if I have the gene called the ApoE4 gene? Is there a way? I said, yes. How much are you willing to pay for it? The money doesn't come to me. It goes to the hospital. I'm in private practice. Right? Not only that, you pay. Not only do you have to pay, you have got to wait because you are now deemed fit. You have a clean bill of health. The Singapore healthcare system gives priority to people who are diagnosed with something like dementia or Alzheimer's. So you want to test just to prevent, you got to wait like 6 months if you want to. If you really want that kind of test. So instead of waiting for decline, she took action. She started learning a new language, right? She's a Chinese and she started learning Malay. Yes, it's an Asian language. Malay is not that similar to Chinese. She started dancing twice a week. That was her, in fact, childhood hobby. She lost it during her years of career. She found it at the age of 63. And she maintained a social routine, right? Every single day, she knew as exactly this part of the day, she'll connect with somebody. It could be a family member, it could be a neighbor, it could be a friend. So every single day, Monday to Sunday, she would have at least one person to connect with. She ensured that if something happened to her, people would realize she she's missing, or her speech is somewhat different, or she reacts differently. Today, her memory is sharper than ever. She's living proof of the fact that our choices today shape our minds tomorrow. So, if I can share with us in closing, that this is something I hope we take away from this, my sharing. Right? While caregiving is difficult, yes, while caregiving is challenging, we don't have to be stuck as a caregiver and think it's doomed, it's my turn next. After my loved one is gone due to this illness or that condition, it's my turn next. Where dementia is concerned, it's especially true that you could start to take action today. The question is, would you like to take action today? Think about the nun study. The nuns who had Alzheimer's in their brains, but they never had it. They never lost their minds. Think about my client, this retired teacher, at the age of 63. She refused to accept decline as her destiny. What about your own future? Will you commit to training your brain, vitalizing your veins, and sharing your stories? Because today, we won't just care for others, we will change the future of aging if we start now. From care to change. From caregivers to change makers. If this message resonated with you, thank you so much. And if you like to join me, type I commit in the chat. If it is something that you like to do today for your own brain and for your own life, type I commit. Thank you.
The Global Caregivers Network proudly presents the second annual Global Male Caregivers Summit, happening April 12th, 2025, from 9 a.m. to 1 p.m. Eastern Standard Time. Join us as we welcome 10 extraordinary male caregivers from around the world